Alright guys, one of the common challenge that we are facing relating to the bones is to understand that which one is the right, which one is the left one. So I will explain the bones of the upper limb now, and I will give you clear picture and some important tips to recognize and differentiate right and the left bones. So here you can see I am holding your arm bone, the humerus. This is the scapula. You have to understand that humerus is basically the arm bone, and the head of humerus is always facing towards your body, towards the medial side, towards the glenoid cavity of the scapula. So first of all, you should understand the bone direction. Like this is the anterior view of the humerus, this is the posterior view of the humerus. Here you can see this is the medial side of the humerus, and this is medial epicondyle, this one is the lateral epicondyle. So here you can see, as you can see, the head of the humerus is facing towards the scapula, and this is the medial side, and this one is the lateral side. So it is attached with the scapula, and this is my right scapula. First of all, you should understand that this is basically the anterior side of the scapula. As you can see, the anterior side of the scapula, this is a lateral border. So this is the lateral view. You can see the glenoid cavity, you can see the coracoid process, you can see the acromion process. So it's like, this is outer aspect, this is the lateral border. Here you can see also that this is the lateral border, inside is medial border. So as the head is facing towards the lateral side, towards the head of the humerus, this glenoid cavity is facing the head of the humerus. So it means this is the lateral side, this is the lateral border, and this is near to the midline, and this is basically the medial side. So this is the medial border, and this is the anterior border, and this is the anterior surface, and this is the posterior surface. I hope this makes sense. And on the left side here you can see that this is the left scapula, and this is the lateral border. On the posterior side, if you can see, on the posterior side, here we can see that you can see the medial borders of the scapula. You can see the medial because they are near to the midline. So these are the medial borders, and then on the posterior side you can see the spinous processes also and the fossas also. So in this way I hope you understood that how to differentiate right and left humerus and scapula. That humerus is always facing towards the scapula, towards the head of the humerus is always facing your like medial side, and then you can easily palpate the prominent the medial epicondyle also. So anterior side bone direction and some important landmarks, it will help you to recognize right and left one. But the major challenge is to understand the radius and ulna, that which one is the right one and left one. As you can see, this is basically the bones of the forearm. Okay, so here you can see these are the bones of the forearm, and bone on the lateral side, it's like this. Bone on the lateral side of the forearm is your radius, and on the medial side of the forearm this is your ulna. So actually what happens that you should understand the landmarks also, and when you are moving this elbow joint, like you are flexing your elbow joint, and anteriorly you can see that this is the radial fossa, this is the coronoid fossa. When you are flexing your elbow joint, this head of the radius is moving inside the radial fossa, and this coronoid process of the ulna is moving inside the coronoid fossa. In the flexion, it's like this. And now you are extending, you see posteriorly now olecranon fossa is free, but now I am going to extend your elbow joint, and it means olecranon fossa is moving inside, olecranon process is moving inside olecranon fossa. So this is the basic significance of these depressions or fossas, because they help in execution of full movements. And there are some strong collateral ligaments like lateral collateral and medial collateral ligament, which prevent the abnormal dislocation on the medial side and on the lateral side also. But how to differentiate that ulna or the radius is right or the left? I told you that radius is basically towards the thumb side, is on the lateral side. Ulna is on the medial side, and first you should understand the landmarks of the ulna. Always check the bone first direction, that whether this is anterior side or the posterior side. So here you can see this is anterior side of the ulna. So first you should understand the landmarks also. Here you can see this is olecranon process, this is basically your coronoid process, this is the trochlear notch, and there you can see the radial notch. This is really important and one of the major landmark, and it will help you to differentiate right and left. And then it's the head. So its head is in opposite direction. The only bone, the head is in opposite direction, head of the line, and you can see the styloid process. So you should understand, guys, that actually what happens, that styloid process is towards the medial side of your body, and this radial notch is always facing towards the lateral side, because lateral side you have got bone radius. So actually what happens, that head of the radius is articulating with the radial notch. So it's mean the radius bone is on the lateral side, ulna is on the medial side, but radial notch is actually facing the radius, so that's why it's on the lateral side. So it's clear now that this is my left ulna. Here you can see this is my left ulna. Here you can see styloid process on the medial side and radial notch is on the lateral side. So in this way you should understand about the radius also. Please come closer. So you should understand about the radius also, that this is the styloid process of the radius, and this is towards your radial fossa, this is towards your snuff box, this is on the lateral side, and this is the site of the articulation of your carpal bones. And then you can see the head of the radius, and this is the radial tuberosity. So radial tuberosity is always facing anterior-medial side. So you can see the anterior side, and then you can see the radial tuberosity is facing towards the ulna anterior-medial side. So in this way you can differentiate the right and left radius and right and left ulna, and then you can see the sharpest part of this both radius and ulna bone. These are called the antrochous part, and there will be antrochous membrane which help in like movement of middle radioulnar joint, like you can do the supination and